And one. Good morning, everyone. Good morning. Good morning. I'm waiting for TikTok to tell all of our friends. Just gotta get this on my phone. Hurry up, fast. So we are live. Good morning. Uh-oh.
What's up?
You see how it's blurry?
Yeah, but it was like that yesterday. Although my eyes are very possessed. We're frozen.
I don't know why.
Is it Wi-Fi?
I really don't know. Okay, let's put this way because the phone is weird.
There you go. Well, no, it still is really slow.
Okay, we're gonna just ignore it.
I'm trying to test it.
To see.
There's like a long delay.
A delay, yeah. There's a delay.
Oh, is there always a delay?
Yeah.
Oh, okay. So that's on purpose.
Yeah.
Oh, okay.
And then this phone is delayed. Like, you see how I have to you see how it's in the middle for us here, but on here I'm like cut off, but right there I'm not cut off. I just have to just ignore it because they're not gonna stress me out with this little stuff. But good morning, guys. Good morning. Money says, hey, Money Red, she's back. That's the one that wants to be your ambassador. Zai says, hey, that's from yesterday, Zaide. Did you ever get a chance to call her? Okay, bro. Okay. Zaide, he's gonna.
Sorry, I'm gonna call you. I finished late yesterday.
He's gonna give you a call. Okay, I'm gonna remind you.
Well, no, the other thing is I gotta call them work phones.
So after live sometime, we'll do sometime today.
If that's okay.
Yeah, if that's okay, Zaide, for him to give you a call sometime today.
Otherwise, it can run off. But sorry, they had me working late, so yeah.
Aww. They said, did he change to your location?
Dr. Labrador's clinic. It's not my clinic.
I'm at his location. He's like,
not, yeah, it's amazing.
Okay, but yeah, I'm at his location. So I'm here at Flagler today. As you guys know, at the Flagler location, Dr. H is here, along with Dr. Schusterman and Dr. Meniscus. Those two are here at this location, and the rest of them are spread out across the other two, okay? It's a bunch of surgeons, and the rest of them are spread out, okay, across the locations. But yeah, I'm with Dr. H today, and hopefully tomorrow, and the next day. I'm playing.
I'll come in on Saturday if you want me.
But yeah, so feel free, y'all, if you guys have any more questions, to flood the comment section with questions, okay? It can be about literally any and everything. We're here to answer questions. We'll be live now. And then when is our next live? Today? Right? Sometime later today? Yeah. So, yeah. Perfect. Yes, y'all. We're spending the whole day together, okay? So we're talking content. We're talking lives, everything, okay? So feel free to flood the comment section with questions.
I feel like I'm so blurry.
Yeah, that's how. I don't know what the phone's like that.
Okay.
Maybe we should special request the other phone.
You want to ask mine?
Yes. For sure. Next, I see Chanel. Good morning. Chanelica says, good morning. I didn't even get a notification. Yeah, TikTok does not send notifications because TikTok is weird. I'm playing. But, girl, I'm glad that you joined us. Mia Cash says, good morning. Good morning, girl. How are you? Welcome. I'm here with Dr. H. So, Mia, flood the comment section with questions, okay? But, yeah, y'all, feel free to flood the comment section with questions down below. I'm going to go ahead and answer some questions. Well, I'm going to read them so Dr. H can answer them. But I do want to kick off with a few questions, like I always do, that the patients commonly ask, okay, on live. So we're going to just start there. And then when you guys ask questions, Money, I don't see no questions, girl, and Zai, I don't see no questions. But when they start to ask questions, I'll just read them and ask you.
Okay.
Actually speaking, I see the question. The first question.
Sorry.
No,
I gotta
okay.
not see your phone because I look very
What?
Slow.
No, I know it's like.
All right. I'm gonna look at this phone because I feel like I look better.
Yeah.
Anyway.
Next, I see. Can I get the top of my faja altered?
Talk to your surgeon, please.
No, you're her surgeon.
Ah, okay. Then yes, I'm just making sure. Because look, at the end of the day,
everybody's technique is different.
everyone's technique is different, right?
Yeah.
Sometimes we all have the same, we all have the same goal in mind, I'd like to think, and then we all have a different way of getting there. And so I always say talk to your surgeon first if it's me. I like to check in because it also depends, at what phase in your recovery that you're at.
How many days post-op? Sorry, go ahead.
Well, allowed to ask that?
Yeah.
I don't know what we're allowed to ask. I'm letting you.
Of course.
Okay. But it just depends. And honestly, more than that, more than the days itself, I always say to schedule an appointment with the clinic staff so that way they can give advice on it. Because everyone, has a different path. If you think about like when the fluid's reabsorbed and all that, ballpark usually you're looking at so we put you in one garment usually. And then about 3 weeks later, you kind of downsize, and then you may even continue to downsize. Or, the garments are not all one size fits all. So sometimes you do need to tailor them, but if people are using other garments, I always say to check in with the clinic staff so that way we can make sure it's got the right fit.
Perfect. Next I see Katie Joe, 33. Welcome. Katie Joe says, how much for just Lipo 360? Now, for the price of Lipo 360 or anything, please leave your name and number for me in the blue note box to the bottom left. It's like the bottom over here, down below, a little tiny blue note box. Somewhere over here.
Where's this?
No,
it's
it's
I'm really not good with social media.
You're good. I got you. I got you, okay?
That's why, I'm very grateful to have their help because
Yes.
I don't know how to use it. But I do like when patients share their stories. It makes me feel
happy.
Good. Yeah.
So yeah, leave your name and number in the blue note box to the bottom left of your screen, okay? So that we can go ahead and get you a price to your phone, okay? A full price list sent to your phone, Katie Joe. Next, I see Hazel says, hello, girl, hey. And Dr. H, Hazel says, hey. Hazel says, hey. I see. Or should she just buy? Okay, so should she alter the top of her faja or just buy a new one?
I don't know. I'm someone that if I'll give somewhat of an answer. If depending where they're at in the recovery, check with the clinic staff first, please. But
she's
generally,
14. I don't know, 4 weeks tomorrow. 4 weeks post-op tomorrow.
I would say check in because maybe we want to get you in a different size garment too, But sometimes, the proportions for the garments, they're not one size fits all. So sometimes patients do need to get them brought in, But you just want to make sure that they're not being brought in the wrong area because, like I said, I think the easiest thing is just to check in with the staff because sometimes people adjust things, and same with seamstress or whoever it is, they may have recommendations and it's a different way to get to that same goal, but it may kind of muddy the picture sometimes. So that's why I say just check in with the clinic staff. They're happy to give you a call back.
Perfect. Next, I see down below, some of my stitches are still in the one under my cheeks.
We can get those out. It's been
4 weeks tomorrow.
See, so I use really, if it's for me, I use really tiny sutures. Not too tiny because if they're too thin, it's gonna pop open, right? So sometimes the body just doesn't dissolve them or the friction, but we can trim those out. I would say pop into the clinic and again the staff can help you remove those.
That's the one that you gotta call today anyways.
Yeah. Mm-hmm. But to pop into the clinic, that's usually what I first advise. If not, call the clinic first, please. Sometimes we think something's one thing and then it's something else, if that makes sense. So usually it's a stitch or something, but sometimes someone's feeling something else, and I'm someone that I like to control the things I can control, and I want patients to have a good result. So, and I'm always happy to talk to them. I think that's why I started that other Instagram. So if they have questions, they can reach out to me. I always say reach out to the clinic first, if that's okay. But if they want to talk to me, I'm gonna do my best to get in touch with them too. And then the clinic, they should always notify me.
Yeah.
So that's kind of the...
Perfect. Next I see, oh, we got more. I didn't see those. Yesterday I didn't catch the answer. This is Hazel. For the 20th, will Dr. H be there on the 20th of this month? I'm assuming, yeah. That's when her daughter's coming for surgery.
Oh, okay. I know. As far as I'm aware at this moment in time. But I can't. We have to skip those.
Okay.
But as far as I know, for that day.
Yeah. Next I see down below, what's your favorite thing to do when it comes to
of everything, to be honest. I don't know if early on we had this talk, but I've said this story probably, it was a long time ago and I said it too many times. Lipo back in the day was not the most exciting things. Like I remember in training when you had to do lipo, it was like, eh. But now it's a lot of fun because I think it's changed. You know, we're not just doing it to like debulk and remove fat, but we're doing it to give curve, give definition and sculpting and things. And so I enjoy that. I think, I don't know, I like a variety of things. I don't really have a favorite. I mean,
just depends.
even when it comes to face and things, like it depends.
Mm-hmm.
And I think variety's nice in life, you know?
Yeah. Okay, next I see, how old are you?
Pass. 74.
Why did you say fast like that? Oh, they really said y'all, but
Oh, you go then, if you want.
okay.
I am not.
Rock, paper, scissors, shoot. I'm playing.
Mm.
Dr. H said pass, okay?
I'm 38. Almost 39.
Why do you act like you're so ancient? You're
Because
not
compared
old.
to you, I'm like double your age.
No, oh my gosh. He's not old, guys.
And
He's
I'm
not
an old
old.
soul.
He's not old, okay?
Old soul.
Forever young.
Usually, well, now I sound like one of those. But usually people think I'm younger. but yeah.
Oh my gosh.
But I am an old soul, I will say that.
Please. Next I see Justin Tick Katie says, perfect girl. Thanks for leaving your name and number. Do not forget. Okay, so guys, once you leave your name and number so I can like explain what happens, it goes directly over to a coordinator, okay? So they see your information, the coordinator, and they will contact you. So once they contact you, you can just go ahead and request to have either a free consultation, it's free, virtually or in person, or request to have a price list, because I can't say the price on TikTok, unfortunately. But if you request to get a price list to your phone, you can get that sent. Sorry.
No, it's
Directly
not.
over, okay?
You're good. I'm the one that like.
I had to make sure that, you know.
When you're over an operating room table all day.
Yeah, gotta make sure. Shades of Faith says, hey girl, hey, how are you? Welcome, girl. You see, I got Dr. H with me, so feel free to drop your questions. Next I see, oh, Zai, I see what you said, Zai. 4 days post-op, I don't want to say it. I didn't want to say it. LOL. Next I see Everything Funny 95 says, good morning. What's the price for lipo only estimate? Unfortunately, I can't give you a price because TikTok does kick me out. So if you leave your name and number in the blue note box, Everything Funny 95, it's like a tiny blue note box somewhere down to the bottom left of your screen. If you put your first name, last name, number, like fill out that form and then hit submit, I'm going to have a coordinator contact you so that they can go ahead and get you a price sent to your phone, okay? Next, I see in the comment section.
Sorry, it's the delay of the video.
It's like different.
Yeah. Is that what they see?
No, they see this.
Oh, yeah,
That's what
what
I'm watching from my phone to see
Yeah.
like what they're
That's what I'm saying.
seeing.
You look robotic.
No, we did the robot dance.
You're way better. I cannot dance. I do not get the dance gene.
Oh my gosh. Next, I see. Oh, they said you're young. OMG. I told you he's not old, y'all. Okay.
But old soul. I really do think I'm an old soul.
He thinks he's so ancient.
Not ancient, but which is, oh my gosh, you're the one that talks like, and I'm like, you know, I'm twice your age. Like, okay, we were just talking about another individual who works here, and you, oh yeah, and they thought I was the same age as that person. And I was like 2 years older than you. And I was like, oh my god.
That's no. In my mind, we're the same ballpark.
She's an ageist.
She
an ageist.
no.
Yeah, you're about to be like, she is an ageist. No, Ayana's amazing.
Oh my gosh.
That's all you have to know.
You're funny.
She's a wonderful person.
And you're a young, amazing, young. Okay? Young surgeon.
Thank you.
We got to put it in his head, okay? Next, I see Dr. H. This is Gael. I believe her name is Gael. Says Dr. H is amazing. 7 weeks post-op, and I'm in love with my results. My waist is literally missing now. She got to find a search party to find her waist.
Yeah. Thank you.
A search party to find the waist.
And if any patients are comfortable, because it's, well, I don't know.
What?
I
Pictures?
just say, yeah, like post up
Of
to this,
course.
whether they're for us or to that social media account for me or this, not this social media. I don't think this is mine, right? This is theirs.
This is
So,
Avana's.
Probably they could send it to this one too. Then.
Yeah.
Okay. So you could probably send it to this account or to my new account or to my Avana account, which is the one they helped me with, which I'm very grateful. So there's people that answer that one.
Yeah, so if you guys want, you can definitely make a post on like Instagram or send a picture, whatever's most comfortable for you. And yeah,
zero pressure. Because
Yeah.
I'm that guy that like when I go running.
what?
I'm gonna tell an embarrassing story now.
Yeah, tell. Oh, it's story time. No.
Even when I was like young and I think it was because I was so skinny in high school.
Mm.
When we'd like take our shirts off, I was always uncomfortable. Because I was like the same height I am now, but like 110 pounds. Well, 115.
Oh.
And I'm like 190.
How tall are you?
I say 5'11". But when I'm like this, like 5'3".
In my mind, I'm like 5'11".
5'11".
I'm 5'11" in my mind.
And I will say I'm like Miami tall, which is great.
Oh, you're definitely.
Because Michigan, I'm not really tall. I'm probably on the shorter side. But
Very-
everyone here is very like, oh my gosh, you're tall.
No, you are tall.
Oh my gosh. My program director, chief of surgery, amazing guy. Like,
Hello.
beyond amazing. But he was like twice my height. So I
Really?
had to use like almost 2-step stools in the operating room with him when I was.
Oh wow, that's really tall.
Yeah, he was a great guy.
Shoot. It's real tall.
Shout out to Dr. Barnwell, a great guy.
Oh,
Fantastic
Next.
surgeon.
that's nice. So DM, no, you don't have to DM. All you gotta do is leave your name and number in the blue note box to the bottom left. And oh, thank you, she already got it. No pressure, no problem, girl. Next I see. I knew he was young because he looks young AF. I told you you look young.
You know what it is? It's because I've spent a very long time in training.
Mm-hmm.
And that usually means you're working a lot, right? Residency and all that. So I don't see the sun. I don't really like to drink, to be honest.
Mm-hmm.
It's just, I would rather eat. I'm more of a man child, but I'd rather have a root beer float
Yeah.
than a pizza.
Mm-hmm.
Which as I get older, I need to watch what I eat. But yeah. So I think that's a tip. Low alcohol consumption and care
And
for
say no
sunlight.
to drugs.
Yes, always. But also sunscreen, which for our patients is a thing too.
Mm-hmm.
Ever since moving to Florida, I get way more freckles.
Really?
Yeah, I mean, the sun's a
The
lot
sun
more
is-
intense. In Michigan, I mean, half the year it's,
Freezing.
gray. Yeah, and gray because of that.
See, told you look young. What's your new account? They asked. What's his new account? On Instagram, because we typed it in yesterday, so it should be.
Again, you do not have to. So
The patients want to know. So it's Dr.Christopher.Hamamjian, okay? That is the new account. And
it's a little lame, but the post on me that means the most to me, I think it's the most recent one. It was like one of my first patients, and she's just amazing. And that account for me is to remind me why I do what I do. I don't know. I think a lot of Instagram sometimes is for advertising and showing things, and it is that, I guess. But I was always afraid of social media. But we're in a world of social media, so embrace it and use it for good.
yes. And I put it in the comments as well, y'all. So
I will say if I'm mum will tell me because I get nervous.
no, it's okay.
I'm not in high school I used to
Dread public speaking.
Yes.
Really?
I still do. That's why these like full days of social media are like.
They're like, that's enough. It's
But
okay. I
you make
got
it easy
you.
for me, and I'm grateful.
Thank you. I do my best. Have you ever had a complication during a doing a BBL?
I mean, we all have some sort of complication.
No, I think they mean severe complications,
Oh.
not the little ones you're talking about.
Oh, I mean,
Or you can, if you feel okay with
I'm also
explaining.
superstitious.
Okay.
That's really what it is.
He doesn't want to jinx it.
I never say never because I think sometimes when you say never is when something happens, and that's a very irrational thing. And I'm a very controlling person. Yeah, I even want to like jump over that. But I will tell you a story. if that's okay.
Yeah, you can tell. It's story time, ladies, okay?
When I was in training, I had another fantastic surgeon, and I remember it was vascular, so like connecting blood vessels, and so like people who don't have a pulse. And I was like, oh my God, it looks fantastic, it sounds great, and it wasn't that, but I was like, oh, it sounds great, and it looks like a really good bypass, and he was like, never ever say, it was the only time he's gotten mad at me, because he was superstitious too, and he was like, you don't say that, because like, he's like, you don't put that energy in the...
Yeah.
Man of science, but I also asked you about your horoscope, so take it for what it's worth. But
no, I got you. Okay, so to answer, would we say no? But he doesn't want to because
jinx anything.
He doesn't want to jinx it. But put it like this: amazing surgeon who is super, super careful. I would definitely say that your patients can attest to that too.
For better or for worse. I feel like when it comes to work, being picky is great.
Oh, that's good.
Probably in a relationship or personal life, not as great.
And just no, that is great. Are you giving the girls relationship advice? He's like, no.
Anyone relationship advice? They can give me their relationship
My
advice.
gosh. But yeah, long story short, he's very careful. Okay, very, very careful. Super picky, which not in a bad way, but in a way where it's like. You take pride in your work, so it's like you don't want,
Also, I'm uncomfortable with compliments, so yeah.
I
did get some advice yesterday. Someone told me to just let them have.
Yes, advice. That's the best advice for compliments.
But it makes me uncomfortable, so.
Oh, I got you. I won't. Anyway. I'll just read them. I won't say them, but I'll just read them.
I don't have to read them. They can read them. I'll plug my ears.
Oh my gosh, but Starfire, no. Where are you from, Dr. H?
Initially, most of my life, Michigan.
Michigan?
Yeah. You know, where people from Michigan show where they're from. Do you know a good way?
No.
It's Michigan.
Oh, I'm not good with geography.
It's the Mitten State.
Oh.
And then, if you want the Upper Peninsula, I can't do it backwards, but that's the Upper Peninsula, that's Michigan.
So, guys, I'm not good with geography. He was just showing me with his hands, but it's... Wait, so you stayed in Michigan all your life? That's what I wanted.
Pretty much. I was in Atlanta for a bit, too.
That's what I'm trying to think, like, didn't you move to some Atlanta?
I was in Atlanta for about a year and a half.
So, Michigan, Atlanta,
yep.
Florida?
Yep.
What was your favorite?
Miami. I don't know, there's parts of each of them I like. It's hard to...
Sorry.
I'll let you. you.
Yo, five.
I like different parts of everything. I think, and that's the same with surgery. But
Miami was your favorite?
I'll let you. Miami has a lot to offer. Michigan, I will say this, I always used to want to get out of Michigan, and then there's things I miss now, and even with Atlanta, it's always like, not the grass is greener, but I think it's the same thing with surgeries. When you ask my favorite surgery, like, I like a lot of things. I don't know, I think variety's nice.
Question, when doing surgeries, okay, this is from me. Ayana has a question. Are you one of the surgeons, because they always have this question, when it's like, let's say if somebody wants a super, like, unnatural BBL, like, very extravagant, would you be the one to be like, hey, to put my 2 cents in, I don't think, this size is good enough. Like, some surgeons will literally say, no, I'm not doing that procedure. We have somebody that will do it, but I'm not doing that procedure. So...
I'm someone, safety's first for me, always. The other thing is when you think about ethics, and so the word natural is an interesting word.
Yeah.
Because sometimes that can mean different things to different people, right? And so that's why I tell patients to bring their inspiration photo. Because that helps me kind of understand things. But I think there have been patients that have had interest that I try to steer them in a different direction. But everything has to be consensual, right? At the end of the day, it's not about me, it's about them. And so as long as it's, there are certain boundaries for me I would not cross that I would say you may be better with a different surgeon. But I think it's important to have a dialogue, and I think that's specific to me with patients, and that's why sometimes I spend an hour on a consult with someone, and it probably isn't the most fun for the staff in the room. But the staff are great, And so, you know, I like to take my time and try to understand people.
Perfect. Next I see, OMG, just let us love you, Dr. H, but I understand.
You know, now I want to like...
Just let us love you. Let us just compliment you all day on the amazing work you do. Your patients love you though, honestly.
Thank you.
Trisha says, how long should I wait for a second BBL reduction, and what should I ask the doctor to do for the best results?
A second BBL reduction. So I honestly don't do a lot of those. If it's a second BBL reduction, I've done, I guess in a way, a first BBL reduction, if that makes sense. Like I've edited that.
That's a funny word. You edit the BBL.
Well, you edit things always. I don't know.
Mm-hmm.
Fine tune, or I don't know what to say.
It's okay.
And obviously with their permission always.
Mm-hmm.
I don't know. It's hard to kind of gauge because I don't know what that first surgeon did for you. I would anticipate the reason for two-staging it, if that patient's talking about, is to
go smaller.
But if you like deflate things too quickly, you don't give the. It's kind of like with Ozempic and stuff. Like everyone knows this.
Yeah.
That's the one that most people know. So like weight loss, if you lose the weight too quickly, it doesn't give your skin time to kind of recoil, and so my guess is that's why they two-staged it.
So how long should she wait for the second BBL?
Talk to your surgeon too. Oh wait, the second
reduction.
That's what I'm saying. Talk to your surgeon.
Okay.
Because they know how much they removed, and they know, you know, it's hard to.
Have any advice for what she should ask, like when engaging a surgeon?
I guess one of the first things I ask, and look, every patient's not going to love me at the end of the day, and as sensitive as I am, I have to be okay with that. And so I think when I've had someone who's seen someone else and then they're coming to me, just understanding their motivation, and it's not that doc wasn't good enough or anything like that. It's just I want to make sure that if there's something that maybe that patient was looking for, that I can hopefully provide that to them. And so my first question for that patient would just would kind of be, you know, what is making you want to switch doctors, if that's what they're doing? Because I think initially, you know, if the first person did it and they did a nice job, I would think you would go back to them personally. So yeah, I don't know. It's hard to, but I think talk to your first surgeon. If you're unhappy with your first surgeon, then I think making a consult with the surgeon you have in mind is helpful, and then they can kind of gauge, like, when was this done? How much did they remove? Like, all those things come into play. Sorry.
That's good.
Oh, sorry, Ori, 1 sec. Can I call you? I'm sorry. I didn't mean to pick up. Sorry. Bye. Sorry. That is my fantastic person that helps me.
That's hilarious. Next comment is, right before going under anesthesia, I told him he has really amazing skin. He looks really young.
Let's stop with it. What did we say about it?
Oh, sorry, the compliments, sorry. Next I see in the comment section, how do you enter? Leave your name and number in the blue note box to the bottom left. You can get a free consultation with Dr. Hamamjin. That's how you can. Name and number in the blue note box if that's what you mean by entering.
Any of the other fantastic docs too. They're all great.
Yes. Amazing surgeon and so caring. I was a nervous wreck and he made me feel so safe and calm.
Thank you.
That's sweet though.
I know,
that was
really
very nice.
I'm very lucky. It's interesting, like, as someone who, I've only undergone like a couple, knock on wood against superstition.
Oh gosh.
I've only undergone a couple surgeries, but I always remember thinking, like, I feel lucky to have this done, like when I broke my nose. Like, oh, I feel lucky that I get it. But like, it's interesting being on the other side of it, that like, I don't know, now having like completed my studies and my training and all this and practicing, like, I feel very lucky to do what I do.
You make girls feel super confident.
Oh, the guys too.
Guys too.
And all genders.
And all genders.
Be politically.
I just can't help it. I'm just always like, girl. I be at home calling my dad, my brother's girl. I'm like, I'm so sorry. I didn't mean to call you girl. I'm so sorry. I say it all day. Next, I see, what's the best way to ask for when you want a BBL reduction? That's literally how we'll say it.
What's the best? I don't know. I think just talk to your surgeon that you want things maybe edited or a little bit smaller. Yeah, BBL reduction. I mean, I think that's a good. I think make a consult. Talk to your surgeon.
Okay.
Can I check one thing real quick?
Yeah, go ahead. Can I ask you a question while you're standing up?
Please.
Okay, so what's the statement? Yeah, don't jinx it. I'm just nervous getting it done.
No,
So she's coming to you.
Oh, okay.
Trust me, just like they just want to make you feel safe and comfortable. Do you have any advice to the girlies that feel nervous that are coming to you?
No, I think I don't know. I think it's normal to be nervous. I think I tell people, like, if you're only nervous or you're only excited, you probably shouldn't be on the operating room table. I think that spectrum kind of goes back and forth, like the ratio of it. But I think that if you're those two emotions, then you're in the right place if it's something you're committed to. If that makes sense.
Makes sense. What's your BMI?
It's in flux right now. I prefer a BMI under 30, but it kind of ebbs and flows sometimes. It just depends on the patient. But I think one thing that is really important, or one of the things, is I think having weight stable. I'm not someone that usually advocates for like gaining a ton of weight for surgery. I think you should actually have stable weight. Sorry, I feel like this hat is.
I'm gonna show off your hair and just like.
Piercing.
Oh.
So sorry. What were you asking again?
The BMI.
Ah, that's right. So, yeah, it depends on the patient a little bit.
Okay. Next, I see. Oh, Money says, "Girl, I can't wait to meet him because I'm gonna get him out of that watch. They're gonna get you, or she's gonna get you out of the whole like. She's the one that said, just let us love you, and so she's gonna compliment you till you break out of your shell of not liking compliments.
Or I just collapse on the floor and get taken away in an ambulance.
What? Oh my gosh. You're funny. I told you, okay? But that's a good thing. It's a good thing.
No compliments. Let's get the compliment.
Okay, why are they reducing them? Bella Jim says. BBLs.
I'm gonna be careful what I say too, because there are certain people that are highly socialized. Is that right? Like that we look at in society, that there's always rumors of them adjusting things and whatever. And so I can't speak to if any person's had something done before. But I think like anything, trends change, right? I mean, I don't like to refer to a BBL as a trend necessarily, but I think even beauty and aesthetics have changed. I'd like to think we're moving in the right direction in terms of like, one of the things I think is very beautiful about beauty now is it's, in the past it may have been like a very rigid line of like what is seen as beautiful, and now I think you have a lot of different ethnicities, coming together, and we see beauty in different ways, and I think that that's something that I like to appreciate always.
Ooh. T says, hey y'all. Hey T. What made you want to be a cosmetic surgeon? It's a great question.
I like art.
Because you're an artist. I told you you're an artist.
I like art though.
Okay. Oh, that's the answer? Oh, okay.
I mean, I like helping people. I mean, I can make it longer than that. I don't want to be too cheesy, but
No, it's okay.
I like helping people. I would say it was something I didn't want to do, but sometimes we lie to ourselves. And it's nice, it's nice to be able to help people feel like, sometimes we feel like a certain person on the inside, and helping the outside kind of match that, and especially like people who have had these amazing journeys of even, for example, just simple ones, weight loss, or people who have gone through breast cancer. It's nice to be able to help someone feel more like themselves, but at the end of the day, whatever I do, you know, you gotta be happy with you, and I think that's something I like to instill in patients.
Perfect. Hey T with the body. Hey LOL. Hey girl. Dr. H is so mellow toned. I love that. Okay. What if the patient is 5'7" and BMI is 32.3? Would he take her? Would you take them?
I think you gotta review everything and do a consult together, and I like to be careful because every so often there's a curveball that of something I don't recognize. So, but I'm always happy to do a consult with someone.
Yeah, T said yes. She was 5'8" and hers was 32 or 33. One of them. Her BMI. That was your surgeon. I mean, your your patient. Your patient. Tibisay Arenas says, "Oh, what's your heart eyes?" Perfect. Oh, Chanelli says, "Okay, I want to go to him." She wants to come to you to get that body. See, honey, okay. She wants to come get that body snatched. Okay. But that's amazing, y'all. Feel free to drop any questions and comments down below. We can answer that, but...
And schedule a consult. I'm happy to do a consult with everyone.
Yeah, for sure.
I like to do consults first, so...
Oh, I see a question. Do you see the question?
No, but I don't know that I want to see it. If you're telling me if I see it.
Is the doctor married?
Oh, yeah. Where are we skipping over? I feel like...
You're actually hilarious. Like, seriously. Guys, Dr. H does not...
Keeping it professional.
Oh, like... Dr. H don't like compliments, guys, okay? Dr. H
I don't know if that's a compliment.
That is a compliment. I see heart eyes next to it, but I didn't want to tell you that.
Yeah. I don't have my reading glasses on, so I can't see that far.
See, you get a little... He gets a little nervous, guys, okay? With the compliments. But Money Red said that she's going to get you out of that phase, okay? One day, y'all, we got this. We're on a mission now, okay? We're on a mission. Mission, make it happen, okay? Next I see, when's your birthday? They're asking. Oh wait, Money Rest. Look at the views, right? The girls loved him. I'm sorry. That's gonna be a compliment. Yeah. I was gonna say the girls loved him, Dr. H.
Let's talk about surgery.
Okay, let's talk about. Oh, what? One question was, when's your birthday?
Well, that's irrelevant. I don't know.
They want to know more. That's the beauty of the social media part of it too.
I know, but I don't know. It's in July.
July.
Or is it August?
Did you tell me that? I think it's not pregnant.
Or January or February.
Okay,
or March or
middle July or.
Don't worry about it. I'm here. That's all you gotta worry about.
No, we need to know.
It could be March. It could be April.
So what about a birthday celebration?
Yeah, no.
Oh my! I know
you
last.
Know I would turn.
Last year, okay.
I had them skip it.
He didn't say it was his birthday. We knew the day of, okay? We knew the day of. And I had to run, and I was like, today is Dr. H's birthday.
You did that?
I'm sorry.
Alright, next. Surgery talk.
He's like, you did that? No, I couldn't believe you. Why would you want to skip that?
Surgery talk.
Oh my gosh.
Surgery.
Are you mad that I did that? No.
I'm mad.
No, but we had to. What? We had to make a post and everything. I was like, right now, go on Instagram, let's make it happen. But dang, did I skip that? No, I got it. But that was funny. No, I mean, the fact that you skipped it wasn't funny, but that was funny. Next, I see 7 weeks and I'm now itching like crazy, but is it normal for my skin to be peeling? Gael says.
There could be some dry skin. I think schedule a virtual with the clinic. I don't know if we can take the names down. I don't have access to this, so
we can definitely. So y'all leave your name. Like when you have concerns like that, leave your name and number in the blue note box. And what we can do is, if when the coordinator contacts you, just like request to speak to Dr. H, because that's
clinic staff.
No, that's your patient.
No, I know, but probably ask to talk to post-op, and then they can get in touch with me. Because sometimes, if they ask to talk to post-op at Flagler, I think that's the quickest way. I find, because sometimes.
Yeah.
I'm happy to like. I know the post-op team will always call me as well.
Okay.
They're supposed to. So.
So for sure, guys, just request, like, leave your name and number in the blue note box. Request a consultation if you're post-op, with post-op, etc. And then that's how we can get you guys. At Flagler.
Yeah, 107.
No, it's Flagler.
Yeah, I know. I was getting thrown up for a second. Because you're not usually here. I was like, wait a minute.
Next, I see.
But sometimes that can be peeling or dry skin. It could be something simple. But I would say please call. So they can help you.
Perfect. To say, I might be saying her name so wrong. It might be Tibby is laughing. She's the one that asks, "Are you married?" They said, "Ha ha 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 ha." He's funny. He's hilarious. He's actually hilarious. LOL. Don't worry about it. I'm here. LOL. That's Chanel. Cause you say your birth. She asked for your birthday, and you're like, "I'm here." She's like, "LOL. I'm here. Don't worry about it, girl. I'm here." I'm guessing they want to know your sign. Oh.
No. Skip it.
LOL. I have a bad burning sensation when I get out of bed or get up. It's in my back. OMG.
Schedule a post-op. Check.
Schedule a post. Can you explain what
it's hard to advise on certain things if I gotta get the full pictures. Why?
Mm-hmm.
And I like to respect people's privacy.
Of course, but can you explain? Because that's a very common thing after surgery. That like burning feeling, basically. Can you explain what it is?
If you give me because I don't want to ask that patient to give their information over this. So, what would be your example?
Like, let's say, like, after even lipo 360 or even BBL. When I mean burning, I'm just like on the inside, the burning, or even the itching. I know it's I want to let you explain. Yeah,
I mean, sometimes
there you
it's
go.
that, but sometimes it is something else, and so that's why I always say check in with us.
Yeah.
Because I like to cross my T's, dot my I's.
Of course, but from the healing factor, like what exactly? You know how, like, for example, with the itching, that's just like the
pathway of I forget what the actual if it's a cytokine or whatever it is, but that can be sometimes scars will itch.
Big word.
I know that's right.
Like just like with the skin, or like let's say even.
But sometimes it can be a rash. Sometimes it can be a lot of things. It could be from moisture. It could be, God forbid, an infection. It could be a bunch of different things. So that's why I always say and I don't like to give medical advice on these things because
it just depends
I don't have the full picture, and I don't want to mislead someone ever.
No, of course, but it's like a general, because generally the itching and quote unquote burning, it's a very. That's always like when patients come back like, oh, why is it? So not that it's not uncommon, it's common, but it just depends on the particular situation of what you're saying. Like depends on, every case is different, long story short. But generally speaking, probably just your body healing. But Dr. H definitely, like he said, get you a consult, right?
Yeah, post-op check.
Post-op check, consult, whatever the case may be.
It's not even just me. Like I think any of the surgeons would want their patients checking in with the post-op team, so they can call them anytime.
Perfect. Next, I see how many massages. Oh wait, do you recommend after a BBL?
You know, massages were something that before I probably came to Miami, I knew people did them, but I think I have even more appreciation for them now because I really see a difference. So it just depends. Some people, like one standard little algorithm, so to speak, would be one massage every day for 2 weeks, and then like the next, so weeks 3 and 4, you do like maybe 3-4 massages, but it depends. I mean, it depends how much liquid's draining out and things like that. And I think having someone, I always refer to it as kind of wringing a sponge out. Like you don't want someone that's gonna like lightly touch, like pet the sponge, so to speak. You want to kind of wring the sponge out. So the term massage is kind of a misnomer that like, oh, it's going to be relaxing and whatever. And even when I get my massages, I don't like pain, but I like to know that things are moving. And so that's the point of it, is to get things moving. But before you come to a massage, please always eat. People forget to eat, and then they get tired or dizzy or hangry or whatever. So, so yeah, always eat.
Perfect. Another thing that they were asking about the massage is, should their massage therapist like reopen their incision, like stick a wooden stick to
I don't believe they're allowed to. I don't know the rules.
No, that shouldn't
But
happen.
it's one thing if I do it, and I'm just weary of anyone else doing things that, you know, again, policies can vary by state, but I prefer to do it.
Yeah.
Because, again, like I sound like a control freak. I am in like a healthy way, but when it comes to like advocating for my patient,
he don't play no games about his patients.
Yeah.
That's the way you put it.
I mean, you want to treat people like they're your own family or friends, you know?
Oh my gosh.
Anyway.
You're actually funny. Next I see, it's only when I get up or I'm laying down. It's only in my lower back. Itching is minimum.
Okay.
And the burning is not,
But I don't think we should diagnose things.
No, I'm reading the comments.
Oh, I know.
She said it's internal burning, so it's not hot.
I know. But I would say if they could please call.
Mm-hmm.
It would just make me feel better because I don't want to mislead anyone ever. And I go through my set of, or really the staff does, because the staff here, you know, I'm lucky. I always say my part here is kind of meeting the patient and giving my suggestions, and then the rest is kind of up to the company, because I respect that it's a company, and I, you know, I'm an independent contractor more or less. So I come in, I do my surgeries, I try to help the patients feel good, and I try to be there for them as much as possible. But I'm lucky that the clinic has a lot of resources to help with that. So
For sure.
that's why, give them a ring and they can help you.
Okay, Curlandi Etienne, hey girl, welcome, says, can you speak a bit on awake lipo? I love this topic.
I mean, teach their own. I'm never gonna poo-poo anyone. Sorry, that was like, but like, for me, if it's a small area of liposuction, fine. And it also depends on the patient, right? Initially, I thought you really have to have the right situation. Can I do it? Yes. Even in my training, like there were a lot of things I could repair in an emergency room versus an operating room, and you know, when you're a resident, you know, you don't have the full staff and everything, so you check in with your attending, you talk, they advise, and so some things you do in the emergency room, and you know, I always want my patient, one, safety, and two, comfort, and sometimes if someone's very anxious or you know, you really want to pick the right person. There was someone I remember early on here actually, she was like pushing and pushing and pushing, and I remember someone was like, just do it, and I was like, no, I don't, you know, I think she'll be happier if she's asleep. And after the surgery, she was like, oh my God, thank you, I'm so glad I
was asleep for it.
Because she was like, but she's fine, she looks great, she was happy and everything, but again, it's, you know, but to each their own. I have friends that do it, and I think the world of them, and so, I don't know, everyone has their own flavor, right?
Mm-hmm.
Possible, but I tend to want to pick the right candidate.
Okay, so, next question. It has to load. It's a delay, guys, sorry. There we go. Vicky says, Dr. H, I have surgery with you on the 20th. Please be there. I'm flying in with MA.
With Mom?
I think
Mom?
they're from Massachusetts.
Oh. I thought you were saying.
No, because I'm
Wasn't there a patient that was coming on?
Yeah, she's the one that's coming with her mom.
I know. Well, it could be from Massachusetts.
Oh, she said yes, Massachusetts.
I figured. I love that I was like trying to speak cool and go like, yeah, what up, Mom? I'm telling you I'm a nerd. It's okay. Do you need to use the restroom?
Is that your way of telling me end this right now?
No,
Yo,
we
you're
have my
funny.
code phrase.
You're actually funny. Whoa, I laughed in my stomach just now. Guys, he's hilarious, for real. But, there we go. From Massachusetts. Yeah, she's coming in, though, to get surgery.
Restricted? Why do we get restricted?
I don't know. TikTok is always, well, it is a
Just a
plastic
bathroom?
surgery. No, it's a plastic surgery page, so we're going to always get restricted.
Oh.
But we made it far without getting any restrictions. Okay.
I try to
Money
follow
says
the rules.
element.
That's why.
Maybe it's just me a rule breaker.
Trouble.
Money, he's hilarious for real. But I do want to ask one more question before we go.
All right.
And I want to make it a good question. So I got to think of all of the questions that the patients are always asking. We already spoke about like food. Well, we did a video about it, actually speaking.
Oh yeah.
Do you want to talk about it on live really or not really? That's not my
Just
Asian
nutrition.
question.
I mean, I kind of said it a little bit when we were talking about massages, but I think it's really important. Sometimes after surgery, like, you just don't want to do anything. You want to lie in bed. You don't want to, but you gotta really, you know. I tell patients sometimes my job. I like to be the nice guy, but sometimes you need to be your parent and kind of kick your butt to get you moving. And some of those things are getting up and walking, you know, following the rules in a sense of doing the things you should be to prevent blood clots, staying hydrated, and eating well. And eating well for me, you know, you don't want to have like a little juice, a little cracker, because I find those patients, they take a lot longer to recover. You're taking your medication, you don't feel good, and so I think, yeah, I tend to be a food pusher a bit.
Okay.
In the sense of like, you know, we can't have you eat like a tiny bite of a donut and come into the clinic. You're gonna get dizzy, you know.
So you want them to eat like
Yes.
before?
I mean, it's different if someone's like nauseous and throwing up. You want to figure that out first, and then kind of. But yes, I like people to always eat and a lot of protein, because I think protein helps. Even for myself, like there are days that I'm, you know, running around and I don't get to eat or drink or use the bathroom. It seems like.
Mm-hmm.
But if I haven't had enough protein, like you get that brain fog, and I think it's similar for post-op and surgery. Like you need that energy to recover.
Okay. Next, I see when I go from a pre-op, my husband go in with me. He couldn't go the day I did my consult.
Oh.
She won't have me.
I have to
be there.
respect the clinic's policies. I don't generally have a problem with it, but I have to defer to the clinic. That makes sense.
Mm-hmm. Oh, that's it. How does lipo burn occur?
There's different reasons, but I think one of the easiest ways to think about it is kind of almost, if you think about, like, you know, when you're a kid, and I had the worst carpet and in my basement as a kid. It was like this really like almost like wool and fine, and this is leading somewhere, I promise.
No,
but like we'd play and then you'd fall or whatever and you get a bad rug burn.
Mm-hmm.
It's kind of like that. There's different reasons why people get it. That's why I really am adamant that I don't like people smoking minimum, 45 to 60 days before surgery, for me, when it comes to BBL and lipo. And it's not even just smoking, sorry, it's nicotine. And then I don't think, maybe hookah's a thing here in Miami, but like Michigan, it's a thing. We have a large Middle Eastern population, so hookah's even worse because it has a lot of nicotine. So it's really the nicotine that can be a problem. You also want to be careful, getting repeat liposuction, the energy device. There's a lot of different reasons things can happen. It could be your, anatomy and things. And so that's why I really like to take time to go through things with patients. And sometimes there's, I don't want to promote another brand or anything, but there's things we can do sometimes, like products that we can use sometimes to help curb that risk if it's something we're thinking about. That make sense?
Yeah, it makes sense. Now I see, yeah.
Cool.
What is the doctor's Instagram? Oh, they got it. Yep, they got it. Dr.Christopher.Hamausian.
Alright, you can skip that.
Oh my goodness.
It really is for me.
Okay.
I actually turned all the comments and everything off too.
Oh, really?
I think so. I hope. I don't know if you're allowed to, but I might see if someone can help me.
Oh, okay.
Or I'll hire someone somewhere. Because I do it more for me than for
last.
And to like express my. I don't mean like in a selfish way, but I mean to express gratitude for what I do.
Of course.
That's kind of my goal.
Of course. So my last question, I think, to wrap up this live, is a common thing. When patients come, if they have their surgery later in the day, pharmacy is closed. They want to know, what is an alternative medication?
So I, I have to respect the clinic's policies because, I work for them. And so that means I can only give prescriptions the day of. And so what I tell patients is when they're coming for surgery, if their caregivers with them, they can come pick up the prescriptions. I like that as an alternative.
Before surgery?
Yeah, that way, and it's a good time, I think, right? Because I think why, like when you just had surgery or like, surgery is not a long car ride, and do not do long car rides after surgery for risk of blood clots. But when like the last thing you want to do is run around to all these pharmacies after. In Miami, there's a lot of regulations in place, and so they can only dispense a certain amount of narcotics and things like that, and I'm someone that likes to avoid it. I think keeping some Tylenol on hand is always good, but again,
extra strength.
Yeah, but before you take anything, always ask your doctor, please. 'Cause sometimes, people think something's okay, and even Motrin, like I've had people like, Motrin's fine, I've been taking it, and Motrin can make you a little bit more oozy, and or there's aspirin in something, or some of the medications we give may already have Tylenol in them, and so you don't want to give like a double dose of that, because that can be bad. So always check.
Okay.
Right.
Perfect. Oh wait, sorry. Well, this is not a question. This is a statement. Can't wait to meet you in person next week.
Thank you.
Okay, guys. So I believe that this wraps up this live. You guys had some amazing questions. Did you enjoy this batch of questions?
I enjoy everything always.
Perfect. Okay, guys. So we're gonna
making me blush.
We're gonna wrap up this live though. We're gonna go make some videos, okay? And of course, Dr. H does have patients that he has to tend to. Okay. So I'm going to end it. You guys have a great day. They said. See it?
Thank you.
You as well, Money. Thank you so much, girl, and thank you once again, Doc, as always, for coming to join us.
Thank you.
We're gonna be back on live later. I'm not sure. I think they said. I'm not sure exactly what time we'll be back on later. I gotta go see. Wrong messages. But yeah, we're gonna be back on live later today, okay? So yeah, y'all. I'm gonna see you guys later with Dr. H. You have a great day as well. How do I say your name? Is it Tibisay? It's Tibisay. How would you pronounce that? Tibisay. Tibisay. Tibisay.
I guess so.
Tibisay.
Tibisay?
Tibisay? No, you say it way better than me. Because I'm saying Tibisay.
But I like how you do it. I always like to ask people how you say it. With my last name, that's when I'm very like, if one more person ever, like, there was a phase where everyone was like, yeah, hey, Dr. Hamam. And I'm like, please do not call me Dr. Hamam. Please don't call me that. I've tried to ask it so many times.
I remember that. That's how I got introduced to you, Dr. Hamam.
It's not even patience. It was
this time.
I was like, please stop.
Dr. Hamam.
Because it means a different thing in Armenian to say. Anyway.
Oh, they said, yeah. So is it how he said it? Tibisay?
Let me win. No.
Is it how Dr. I think it's how you said it.
I know, I would
Have a
think
great day, Chanel. He said you as well. That is cool though. Hey, you got that right because I was saying Tibisay.
It's a pretty name.
Yeah, that is
cares
a
what it
beautiful
means.
name.
I wonder what it means.
I think you got that right. Tibisay. Okay, guys. So have an amazing rest of your day. See you beautiful people later.
Thank you.
Of course, I got you. Okay. Later, guys.